Mrs. Jones. How are you doing today?
I'm good. How are you?
I'm good. My name is Megan. I'm a nurse, and we're going to do a physical assessment on you. Don't worry about your privacy. Everything will be private. It's only going to take about 20 minutes. And just to let you know, I've already washed my hands, and that's important for the prevention of infection. We took your vital signs earlier. It was 124/76, and that's good. Your heart rate was 74 with a regular rate and rhythm. Your respirations were 16, and you did not have a fever, and it appears that you're not having any pain today, right?
Mm-hmm.
Okay. Your skull, I can tell, is normocephalic. If you could put your head down just a little bit. Your scalp is clean, and I don't see any signs of lesions or bumps. And your hair is evenly distributed. It's blonde in color, very fine texture. Don't see any signs of nits or any lice. So that's good. That's what we want. Okay. Your face is, you've got your eyes in the upper portion of your face, the upper third. You've got your nose midline, and your mouth is in the lower third portion of your face, and that's exactly what we want. I'm going to ask you to close your eyes real quick, and we're going to test your cranial nerve number 5. It's your trigeminal nerve. Just tell me where I touch you on your face, okay?
My chin.
Okay, good. That means that your cranial nerve 5 is intact. I'm going to ask you to clench your teeth. Kind of bear down. Your masseter muscles are strong. Your temporal muscles are strong. I'm going to ask you to smile and frown. Frown. Everything's symmetrical. There's no facial drooping. That means that cranial nerve number 7, your facial nerve, is intact, so that's good. I'm going to ask you to shut your eyes. Shut them hard. Okay, good. And I'm going to try to open them. Good. That also means that cranial nerve number 7 is intact. Let me take a look at your fingernails, please. They're pink, they're translucent, the angle's less than 160. Capillary refill's less than 3 seconds. Let me see your toes real quick. Pink and translucent. Capillary refill's less than 3 seconds. Very good. Good, good, good. Okay, I'm going to take a look at your ears. I can see that they're warm. They have instant recoil. I don't see any lumps, bumps, or lesions. I'm going to take a look here inside. There's just, there's no wax that I can see. There's no discharge, no foreign bodies. Okay, good. You're not having any tenderness here on your tragus?
Mm-mm.
What about the mastoid process?
Mm-mm.
Okay, good. All right, we're going to test your cranial nerve number 8. It's the acoustic nerve. I'm going to ask you to shut your ear real quick. I'm going to whisper a word and you just tell me what it is, okay? You ready?
Mm-hmm.
Okay.
Pancakes.
Good. Okay, if I had an otoscope, I'd be looking in your ear canal right now. I'd be looking for a pearly gray eardrum. I'd be looking for any foreign bodies or discharge, anything like that. Any redness, any swelling. As far as your nose goes, we can see that it's midline. It's not deviated to the left or to the right. I'm going to check your maxillary sinuses. Are you having any tenderness here?
Mm-mm.
Good, good. Okay, close one nostril and breathe in. Great. Close the other nostril and breathe. Okay, now close your eyes real quick. I'm going to put something under your nose and try to tell me what you think it is, okay? This is testing your cranial nerve number 1, your olfactory nerve, okay?
It's like coffee beans.
Okay, great. So cranial nerve number 1 is intact. I can already see that your lips are free of lesions or cracks. They look pink and moist. If I could take a tongue blade real quick. Can you open up your mouth? Okay. Let's see here. Your mucosa is moist. It's free of lesions. All of your teeth appear to be there. They're white. They're in good shape. I don't see any receding of your gingiva. Your tongue is covered in the papillae. Ah. All the way. Ah. Okay. Open up more and go back. I can see that your tonsils are present. I don't see any exudate. And I don't see any redness or swelling. That's good. Now, if I'm gonna ask you to open your mouth. Ah. Okay. Stick your tongue out and go ah. Very good. Your uvula rises midline. That tests cranial nerve number 9. And number 10, which is your glossopharyngeal number 9. And then your vagus, which is number 10. So that's what we want to see, is it to rise midline. Now stick your tongue out straight as you can. Very good. Okay, that's also another cranial nerve. That's number 12, your hypoglossal nerve. And we want to see that it sticks out midline. I'm going to check your neck real quick, take your hair back. I don't see any excessive hair growth. I don't feel any lesions around there. Just do a full range of motion check. Just go front and back. And then left to right as far as you can. We're going to palpate your lymph nodes right now, okay? This is your submental. This is your submandibular. Back here is your tonsillar. Here's your preauricular. Here's your postauricular. Here's your deep cervical. And then we've got your supraclavicular. And no lymph nodes are palpated, which is good. That's what we want to see. Okay, I'm going to take a look at your eyes if you don't mind. Here's a card. Go ahead and hold that over your eye, and I'm going to back up and take my chart here and just go ahead and read the smallest line that you can, please.
FELOPZD.
Good. Now cover your other eye. Read the smallest line that you can.
FELOPZD.
Good. All right, now take down the card and read the smallest line that you can with both of your eyes.
LEFODPCT.
Okay, great. That shows that you've got 20/15 vision. Not bad. If you had to wear glasses, you could, but I know that you don't have glasses. Okay, we're going to check your cranial nerves number 3, number 4, number 6. Okay, that's your oculomotor, your trochlear, and your abducens. All you have to do is follow this with your eyes, okay? Just with your eyes, good, and not with your head. Don't see any nystagmus. Don't see any ptosis of the eyelids. No loss of conjugation. Very good. Okay, great. Now I'm going to just bring this in close and just focus on it. I can see that your pupils get smaller as the pen gets closer. That's very good. I'm going to shut the light off real quick, and we're just going to check your pupils, okay? Okay, I see that your pupils are reacting very well. They're equal. They're round, reactive to light, and they have accommodation. Now I'm going to shine the light again, and I can see that they respond directly and they respond consensually. Very good. That's all what we want to see. If I had an ophthalmoscope, I would be looking in your eye, checking for the red reflex, and I would be looking at your optic disc, and I'd be looking at your retina. But I don't have a ophthalmoscope today, so we'll just skip over that part. Okay, I'm going to move over to the other side. Are you doing okay? You want to take a break?
Okay.
You doing okay? Okay, sit up straight for me. I'm not feeling any palpation. I'm not feeling any bumps or lumps. Your anterior posterior in relation to your transverse is a 1:2 ratio. I'm going to just look behind. I don't see any, okay, don't see any changes in your skin color or any lumps, bumps, or lesions, so that's great. You're not having any pain, right? Okay.
Really.
I'm going to just thump on the back of your chest real quick, okay? Okay, do you mind me taking a listen to you?
No, not really.
Okay. Good, you sit up nice and straight. Okay, take a deep breath in through your nose and out of your mouth. Again. I don't hear any adventitious breath sounds. Right around here. Another breath, please. Good. Another breath. Another one. Good. Okay. All your lung sounds quite clear. You're not having any cough or coughing anything up, right?
Mm-hmm.
Good. Okay, we're not actually going to do this, but if in the future you want to have a breast exam, this is what we would basically go over. They would do a physical inspection. They would check the color. They'd be checking for any striae. They would be checking for any increased veins or vascularity in the breast region. Of course, they'd be looking for any lesions. They'd look at the nipple area, make sure that the nipple area is darker than the rest of the skin around it, and that which is the areola, that it's darker than the rest of the skin, and that the nipples would either be, everted or inverted. That would be noted. They'd probably have you do a position change, usually 3 positions, where you're standing up straight, where you're bending over, and then they would also have you lay back and do. Excuse me. Thank you. And they would do a palpation, either spokes on a wheel or circular or vertical stripes, palpating each part of the breast, checking for any dimpling, checking for any masses or retractions, anything unusual. Okay, the lymph nodes would be checked as well. The lateral, the central, the posterior, and the anterior lymph nodes would be checked, but we're not going to go over that today. Basically, the hope is that there be no axillary nodes palpable, there'd be no masses, there'd be no tenderness, there'd be no nipple discharge. So we'll just skip over that point for now. If I can move your hair back real quick. I'm not, be real still, thanks. I'm not seeing any pulsations on your chest, and that's good. We're gonna go over your valve placement, okay? And this is just where each valve can be heard the best, okay? And I'll do it over your shirt. Okay. Okay, this is where your aortic valve can be heard best. It's the second intercostal space. No, excuse me, this is not the aortic, this is the pulmonic, and it's on the left sternal border. Over here is your aortic in the second intercostal space on the right sternal border. The Erb's point is one more point down, the third intercostal space on the left side. And that's where S1 and S2 should both be heard equally. The tricuspid valve is going to be a little lower, the fifth intercostal space on the left sternal border, which is going to be just up under here for you. Okay, and then the mitral valve will be mid-clavicular, fifth intercostal space. Okay, and so we want to hear all regular rate and rhythm, no extra sounds, no murmurs. Very good. Okay, doing okay so far?
Mm-hmm.
We're gonna check your peripheral pulses now, and it's pretty easy. We're gonna check your brachial pulse here. And they seem to be, they have a regular rate and rhythm. Or check your radial pulses. And they're both equal with a regular rate. I call it a 2+ amplitude. I can already see that the skin's uniform in color from your knee down to your ankles. Skin seems to be uniform in color. I'm not noting any edema. They look symmetrical. I'm going to go ahead and take your dorsalis pedis pulse right here. Okay. And then the top here, this is your dorsalis pedis pulse. This is your posterior tibial. And I can feel both those pulses. Good. Okay, last but not least, Mrs. Jones, tell me your first name, please.
Katie Jones.
Katie Jones.
Mhm.
I like that.
Mhm.
Beautiful. Okay, Katie. Tell me what day it is today.
The 24th.
Good. Good. What day of the week is it?
Wednesday.
Good.
Mhm.
Okay, I would like for you to tell me where you are right now. Where are we? We are
I'm in an apartment.
good. Good, and that's great. And you understand why you're here, right? To get a
Physical checkup.
physical checkup. Good. Okay. Well, it's nice to know you, Katie. Just want to make sure you don't have any questions.
Now, do you have any questions?
I really don't. I think it went really well. You know, this should happen about once every 2 years, and so for a person of your age, should come back every 2 years just for a healthy checkup.